Half? No, that's okay. That's all right. It always is like that. You're so connected to the stories you can't write. That's why I save some for the end. All right, so here we go. I am a student and often can't do much to further my patient's care. That's not your handwriting, it's my vision. But I'm constantly amazed that patients and their families still trust me enough to share their secrets and fears and hopes. What a blessing. I think for those of us that have not been students in the traditional sense of being a student for a long time, we felt that way too, but there's something very special about being a student and being able to just be there for somebody in a way that's different than anyone else on the care team. So don't underestimate what you can bring to somebody. Trust is loyalty, again. All right, so someone wanted to, emphasize loyalty. I don't know if it's the same person or someone else, but loyalty again. All right, trust is being able to share without reservation or fear of judgment. Trust is arriving on time at the agreed time. Did you write that one, Anna? I was late today. I actually think you're right, whoever wrote this. That is such I was having this conversation just a few days ago. And, okay. But it's true. I think that's the other thing that I don't know how to balance, getting 15 minutes to see a patient when I want to give them so much more time. And then feeling like I'm disrespecting all the other patients that come after them. Yeah. They're like, oh, just because I'm homeless or because I'm poor or because whatever, you think I don't have somewhere else to be and something else to be doing? And maybe that's not something that you would value, but guess what? It's my choice. But anyway, that's a tricky one, how to be on time. All right, so trust is hard to gain, but easy to lose. Ooh, nice. Trust is being transparent with your patients. Trust is keeping promises. Yeah, so be careful with promises you make. And trust is feeling at ease under all circumstances. Trust is a mix of vulnerability, love, and compassion. And I always love to see what the last one is because it's sort of usually kind of a summary of one. Trust is being able to count on things. Yeah, that's a good one. All right, so another round of applause for our such an engaged and fun group tonight, and I'm going to invite up our student leaders.
One more.
Wait, you made me do all this and didn't tell me there's another
I
student?
was surprised you were doing it, actually.
I was done! I gotta go, I'm sorry. I'm really sorry to Jeffory Eaton, because I did look at your name, but somehow I just, oh boy. I have lost your trust. Okay. Okay, woo! How red am I? Okay, Dr. Jeffory Eaton graduated from UCSF School of, oh wait, we have our first dentist! Jeffory Eaton graduated from the UCSF School of Dentistry in 1983 and became a volunteer faculty member in '93, helping mentor the community dental clinic program that began that same year. For over 25 years, he has been active in this program, including as faculty director the last 4 years. He is also the senior tutor for the PRDS division at the dental school. He was named Volunteer Faculty of the Year by the students in '93, '97, and again in 2014. In 2017, he received the Dental Alumni Association's highest honor, the Medal of Honor for his distinguished career with the CDC program. Prior to dental school, Dr. Eaton was a music major in undergrad and has performed professionally with artists such as Dionne Warwick, the Righteous Brothers, Carlos Santana, and the Doobie Brothers. Yeah. He considers his greatest achievement being able to participate in the growth of the CDC program and seeing its positive influence on young professionals. So with humility and asking you for forgiveness. Please welcome Dr. Jeffory Eaton.
So, I wear my emotions on my sleeve. I'm a bit of a crier, and I cry at the sad things, I cry at happy things, I'm known to cry in between, and it's because if I tell my story right, I might make criers out of some of you guys tonight too, and that would make me feel good too. So trust. I have no clue what I'm going to say. I trust it's going to be the right thing. The great jazz vocalist Abby Lincoln said, "Stand before the world and speak from your heart, and they will hear you." So that's what I'm going to do tonight. I'm just going to talk to you a little bit about my life and some truths as I know them to be. And there's some dental students here tonight. Word and props to the physical therapist, because you guys got my career back for me. And without your colleagues' help, I wouldn't be standing here tonight. I wouldn't be standing. Because just 7 months ago, I couldn't stand. I couldn't button my own shirt. I couldn't tie my own shoes. I had to have a pretty scary surgery. And I had to look at that surgeon and say, "I trust you. Sure, I'll be able to be a dentist again if I do this surgery. I have more things I want to do. I'm not done yet. I want to keep practicing. Please, how about if I do this after I retire?" And he said, "Are you falling yet?" And I said, "I've been falling." And he goes, "Okay, you can't put this off any longer." I had spinal cord myelopathy, and it was affecting, I was losing my fingers, my grip, my strength, my balance, and it was a pretty scary time for me. I had just come off 6 months of medical leave, and I returned back to being a dentist again, thanks to physical therapy. My story starts back about 1991 when I was diagnosed with malignant myeloma, ocular myeloma. And I thought my life was over. And it was pretty scary. And at one point, the doctor called and said, "I need you to come in. I need to talk with you." And I was sort of hoping he was going to say, "You need to take up jogging, you need more leafy green vegetables." Really good for you. But what he said to me, it buckled my knees. He said, "Listen, we're going to do some metastatic tests." And I go, "What can I do?" And he goes, "I think really you should spend the next few days getting your affairs in order and prepare for the worst." Because, it's about 50% successful with radiation therapy. And if it comes back and it spreads, it's 100% fatal within 6 months, all the time. So every year when I go get my test and see how I'm doing, I go, "Is this the day that the 6-month timer runs?" And so every day I go, "This might be the first day of my last 6 months." So every day I get up with a little bit of joy in my life that I got another day, and I can still be a dentist for another day. God, that makes me feel pretty fucking good. And when I meet people my age and older, I go, "How you doing?" And they look at each other like, "You tell me." And I go, "Okay, you tell me." We're both on this side of the dirt, so we're both feeling pretty good about it. Well, I went through all the things when I found out I had cancer that people do. I go, "God, please make it go away, make it go away. If you make it go away, I'll be a kinder, nicer, gentler person. I'll be a better husband, a better father. I will be more loving. I will be more patient. I will do things to help the world. I will do things to help other people, things I never did before. I will do this. I will." And I caught myself, and I had a moment of shame that I had to have cancer before I was willing to just be a decent fucking person. Shame on me. Why wouldn't you want to be a decent person all the time? Why do you have to be sick before you're willing to do just the right things in life? So I had an epiphany, and I said, I may have cancer, but cancer doesn't have me. I know it's a cliche, but it's my cliche, and I live it. And I try to live by it. And I go, for whatever time I have, for no reward, and no bargain with God, you let me off the hook, how about that it's just the right thing to do? That I'm going to get up every day and I'm going to try and be the best version of myself that I can be for as long as I can do it, for no other reward, that it's the right fucking thing to do. That we are blessed to be picked to get to do these careers that we get to do. Talk about trust. I want to talk to you guys. How many of you are all students? Most of you are students.
Yep.
Okay. And some of you, my granddaughter's here tonight, she's hoping to get into med school someday. I had the honor of serving on our school's admissions committee this year. And I saw what a daunting task it is. 3,000 applications for less than 100 spots. 29 out of 30 things I opened up, we had to say no to. People with fine grades, fine scores. How do you decide who's in and who isn't? It's such a wild ride of who's in and who isn't. And frankly, sometimes it's not fair. And you guys are here. So I want to tell you, after now going through the process on this side of seeing people get in and helping them get in, and working with all the people who interviewed you, 30, 40, 50 people look at everyone before they're admitted. By the time committees and interviewers, and we all get together and vote, you physical therapists, you know, all those people that selected you for this very competitive program. People who voted for you to have this spots that you have saw some greatness in you. And they're not wrong. You can trust that many people are not wrong. There's greatness in you. There's greatness in you. There's greatness in you. There's greatness in you. I know that from the bottom of my heart. Now, I want you to think back to all the undergrad professors you had on top of that, who supported you, who would encourage you, all maybe counselors along the way, all the mentors you've had over the years, family members, people who are supportive. That many people can't be wrong, and they see greatness in you. You can start to trust that there is greatness in you, and you are going to do some great things in your life. I know it to be true. So I decided part of me being good was I wanted to get involved with the homeless program, and I helped start a homeless program here at school. They were just starting one, and I said, I'll come and be a volunteer faculty. I'll do it for a year till the promise wears off, and I feel a little better about that. I dodged this cancer thing. This cancer's here. And then something really weird happened. I started enjoying it. And I realized I felt good when I would go and give of myself and do something and get out of my own head and go do something. And I would see people who had less than me, and it made me feel so grateful for what I had. That every time I would leave here, no matter how tired I was, it made me feel better. It made me feel good. It made me forget any of my problems. And over the years now, it grew from a program that met once every quarter, and we gave away toothbrushes and taught people how to brush their teeth, to where we could talk to school and let us do some films. Tonight, as we speak, across the street, there are over 60 students up there treating the homeless program, doing the community dental clinic. We changed the program to community dental clinic, so it wouldn't sound so demeaning to the homeless. And, you know, but it really was great for fundraising when we called it homeless program, because everybody knew what that meant. So, I'm very proud to say this year across the milestone have provided over $1.5 million in free care to the homeless and indigent population. That's 25 years of graduating students. Some of the students who have left now have come back and have taken volunteer faculty appointments and helped each other. I don't have to be there tonight because some of them are up there volunteering their time helping mentor and helping teach. And I hope you guys, when you graduate, will come back and take a faculty appointment and come carry on the tradition up there at the community. You know? I'm so honored that the CDC finally lived up to its name, because last year we started not just seeing homeless people, we seeing political refugees. It's seeing undocumented workers and undocumented people. Take that, son. Yeah. Human beings. Real human beings. So, the musician Joe Locke is a great vibraphonist, and he said, what is the most important thing we bring? The important thing we bring is our humanity. It makes us connect to another human being. It gives us purpose and lets us become who our true selves are. That's pretty profound for a musician. Anyway, for the last 6 months, I had to learn how to tie my shoes again, how to button my own shirt, And I was hoping I could go back to being a dentist again. And one of the things I did for my physical therapy was going back to practicing my guitar. I was a brass major in undergrad, and I toured and played professionally the trumpet, and I played guitar as a hobby. And so, I'm not going over my time.
No, you have all the time.
If you guys will let me
No
have a
one
couple
else
minutes
after
of
you, really.
Are you sure about that? Trust that.
I trust if this goes well, that my fingers do what I ask them to do. Another great musician, the late great Paco de Lucia, is a great flamenco guitarist. And they said, how do you do the incredible things you do on the guitar? And he said, the hands do what the heart wishes it could say. So, one of the little truths that I've learned in my journey with helping the homeless people and working with CDC, it's an old cliche, but sometimes the cliches are the best because they're true. You ever heard someone say, you know, the thing about Shakespeare that I don't like is he's just so many cliches. See, think about that a minute. Right? So here's what I've learned in my journey. A person is never taller than when they're reaching down to lift someone else up. That leads us to who knows where, who knows where. But I'm strong enough to carry him. He ain't heavy, he's my brother. His welfare is my concern. No burdens he to bear. We'll get there. And I know that he would not encumber me. No, he ain't heavy. My brother, if I'm laden at all, I'm laden with sadness that everyone's heart isn't filled with the gladness of love for one another. It's a long, long road from which there is no return. While we're on the way to there, why not care? And the Lord doesn't weigh me down.
So thank you for bringing the people who trusted all of us to get to this place in our lives, to bring them into the room with us, because that's who we owe so much to, is the people who trusted us to be here. And thank you for reminding us and putting words to what I think a lot of our speakers and storytellers have said tonight, that we're here to do the right fucking thing.
One more continued round of applause for all our speakers tonight. We hope you guys all had a wonderful evening, and before we let everyone go, we just wanted to thank each and every one of our speakers tonight, from the bottom of our hearts, you guys, for coming here and sharing your stories with us. We hope you had a good time. There's still plenty of food, so if you want to take any leftovers, if you have any Tupperware, you want to take it with you. Otherwise,